So you can put flowers on the graves there anytime you want to now? Is it open to that?
Yeah, the cemetery is still open to anybody that wants to go there. I went by there this morning. There's a few people that were there this morning. So, yeah, everything's still open, but no large gatherings.
It's just 9 a.m., folks. Can I just check in with staff and make sure we're doing okay for time? Are we streaming?
I think we're good to go.
Oh, yep. So we're good to go.
Yeah, thank you so much. All right, we'll call this meeting to order. It's 9 o'clock. Well, 9:01 according to my clock. So it looks like we have everybody in the committee in attendance. We just ask if there are any disclosures of pecuniary interest. Please let me know now. I've received none up until this point, and I see none now. So it looks like we're good to move forward with the agenda. And first order of business is an update from our medical officer of health. So I know that Dr. Ranaday has joined us, and there he is. And take it away if you would, sir.
Okay, great. Thank you. I do this every time, but I just want to make sure you can hear me. So can you hear me? Yes. Is that okay now? Okay, great. Okay, perfect. So good morning. I'm going to share my screen with you. And we can talk through a little update on what's going on with COVID. Can you see that? Okay, perfect, great. So I have a few things that I think it's really important to share with you. I'll give you a brief update on the current local status, but of course you can get that every day from our website. And then I'll touch on some important updates related to screening, diagnosis, surveillance, what's going on in the healthcare system, and just one brief word on prevention. So as of today, we've had 230 cases in total. We've had 167 recoveries. We've had 19 deaths, and we've had at this point, a 4% positive rate of the test that we've done coming back positive, and the rest come back negative. This is a screenshot of something from our website, which you can see the cumulative totals of cases. They lag a little bit because we put them in by the date of onset and not by the date that we received them. So after we receive the cases, and then we go back and find out the date of onset of symptoms, and then we're able to put them into this graph. But you can see a plateauing. Oh, hello? You can see a plateauing there here as well as here. And it's important to note that this graph will never come back down to zero because this is a cumulative case count. So what we expect is for it to get flat and stay flat, but it's not going to drop because it's not number of new cases, it's a cumulative total. There was a provincial directive around screening in long-term care homes and retirement homes. So I wanted to provide you with an update here that 100% of those homes with long-term care and retirement have been completed in terms of the staff and the residents have all been offered screening at this point, and those test results are back, and I'll share the preliminary results with you after this slide. Upcoming settings for that directive around screening are going to be daycares, shelters, and group homes, and those will be completed this coming week and maybe early into next week. So preliminary results from the screening that we did in long-term care homes and retirement homes indicate that we were able to screen 1,370 long-term care home and retirement home residents. And we were able to identify five positive COVID cases in those residents. And we tested 1,424 staff and identified one case of disease. So I think it's really important that we sort of take some stock of those numbers and recognize that with a low prevalence of disease, you have to do a lot of testing in order to get any kind of outcome related to finding a case of disease. The implications for that really are that it goes back to something I've said before about the value of this test. As a diagnostic test, it's very powerful. If someone has symptoms and you test them and they test positive, you can be fairly sure that that's an accurate test, although there is such a thing as false positives. Similarly, if you have symptoms and you test them and they come out negative, you can be fairly sure that that's a true negative, although there are false negatives, right? And we don't know the full rates of false positives and false negatives because we just don't have enough experience with this test. or comparator tests. Having said that, though, the value of this test as a screening tool in people who don't have symptoms is starting to become suspect, because you would hope that you would get a lot of cases for your effort of testing all of these folks, and we're really not finding that outcome right now. So of course we're going to continue with the congregate setting screenings in the other settings, but having said that, I think it's just important to take a bit of stock of the volume of testing that is required just to find one case of disease, and then to think very carefully about whether or not such screening is warranted, because it really does only provide you with a snapshot in time, and it's not really an ongoing mechanism of surveillance. And so, what we have been doing in these homes is anybody who's symptomatic gets a test. Those tests come back fairly quickly, and we're also able to isolate anyone with symptoms in one of these homes right away. Not we, but the operator is usually able to. And so, we may end up moving towards a system where we go back to the tried and true, which is to identify symptomatic folks, isolate them, and get them tested quickly. Just a quick update on the other 4 areas. So in terms of diagnosis, there was a serology test that was approved recently by Health Canada. That is, some people might refer to it as an antibody test, and it does check your blood for antibodies. It is not a point of care test, so it is not a thing that can be done in an office in 10 or 15 minutes or out in the community. It is a lab test, so you would need to go and get your blood work done, have that blood work sent to the lab, and then the lab would give you results. It would be up to now labs and provinces to decide how are they going to incorporate this serology and under what circumstances are they going to use it. But in principle, the primary reason for this serology is to identify recovery from disease, people who have thought to have had disease, and then you can demonstrate that they mounted an antibody response and have therefore recovered. The other principal reason for using the test would be to do some baseline, what we call seroprevalence studies, which would be to take a random sample of the population and test their blood to see if they had been exposed to this virus, and then you can determine the sort of background prevalence of disease. And the serology test, if we were to be able to use that in this way, would be far more effective than the current sort of screening mechanism of the nose swab and testing for the actual virus. If I move to a surveillance update, I just want to let you folks know that we'll be launching a population-based COVID-19 survey later this week. We do population-based surveys routinely, but it seemed like this was a good chance to include questions about COVID-19, questions about how folks have been responding in the community, questions about what their current knowledge and attitudes are related to COVID-19. So that will launch later this week. In terms of healthcare, acute care services such as the hospital are preparing and planning to resume with non-emergency procedures, and they're going to ramp it up fairly carefully, but they're engaged in routine planning around how to do that and when to do that and what the green light is. And in terms of prevention, it's, I think, important for you to be aware, just sort of on the horizon, that there was a vaccine trial approved by Health Canada, started out by a group in Halifax, but I'm sure there'll be a wider sampling frame than that. Remember that that's the first of really many, many steps in the development and production and distribution of a vaccine. And that first step is really just to determine if what is being injected is safe. So it's a safety test. And then if that works well, then they'll move on to the next level, which is sort of effectiveness and efficacy tests to say, does it actually protect you from disease? So there are many, many steps to go through, but it is, however, an encouraging note in terms of what we could achieve with prevention over time. I think that's the end of my slides. I'll just confirm. Yep, and I will stop sharing. So you should see me now again. Okay, great. So I'll leave it at that and then turn back to you, Councillor.
Thank you, Dr. Renedy. It looks like we've got a question from Councillor Bird to start you off with. Councillor Bird.
Thank you. Through the chair to Dr. Renedy. Just a quick question. I'm curious, I mean, I know the information comes out through the media at all different stages, different times, and, unavoidable in some cases, but I'm just curious why, in particular, your TV Sonia, that particular outlet gives a lot more expanded information and details, not just the stats. So I wondered why they're doing that and you're not.
Councillor, can you clarify what you mean, the details that you're talking about?
Okay, so rather than just saying 230 cases, 167 recovered, 19 deaths, and leaving it at that, if they say there's a new case today, for example, then tomorrow they might say there's no change to that case, or they had to go to hospital, or they give, the extended information on the numbers already quoted. Not every single time, but I've just noticed that they are giving that information. So I was just curious.
Sure, Councillor. So you can get more information than I gave you in this update on our website. So if you click under the detailed report of the dashboard, there's a whole report that gives you current totals of cases, change in the cases, information on outbreaks, information on sort of the breakdown of cases, so by gender, by age, and things like that. So you can get that all from the website. I just didn't share that with you here because it's available every day
Thank
for
you.
you.
Many thanks.
Okay, are there any other questions for Dr. Ranaday? I know I have one. It's more of a general question, sir, rather than anything specific to do with your slide, but there's a lot of misconceptions out there as to whether or not, while we are in public settings and as our community starts to open back up economically and recreationally, whether or not the message is clear that we should be wearing non-medical masks while we are interacting with other people. Do you have a comment on that?
I do. So I believe that there's going to be guidance coming out from the ministry maybe today or tomorrow around masking. I think it's important to remember that there are many considerations around the use of a mask. And so for me, and I have another presentation on this ready to go for you at a later date, I just have to fix up some references in it. But for me, the evidence and the context does not support a strong recommendation around the public use of masks in people who don't display symptoms. Having said that, as a policy recommendation, it may actually come out that way, that this is what everybody should do. And then I think that the responsibility then rests with the policymakers to enable that outcome to happen if that's the policy decision. But certainly I think if you take the social distancing measures plus the other measures that have been put in place, even those have some modeling evidence behind them, but we've seen that they have worked. The mask, it's hard to tell on top of the existing interventions how much more effective the mask will be, given that the goal of them is to prevent the transmission from people who have symptoms to other people. So if I put a mask on me like this, the goal is really not to protect myself. Oh, sorry, you can't hear me. The goal is not to protect myself, it's to protect others, which leads to the question of what is the prevalence of sort of asymptomatic disease. And we don't really know that with great clarity. The estimates on the possible prevalence of asymptomatic disease range from about 5% to 80%. So if I were going to give you medicine and tell you, oh, there's really good evidence that it works, it's going to work either 5% of the time or it's going to work 80% of the time, you'd probably tell me that's not good enough. Go back and figure out a better estimate of whether or not it's going to work. Similarly, because the range of potential asymptomatic disease is so unclear, but it's more likely to be closer to the 5% than to the 80%, it's hard to say what additional benefit the prescription of mask use, basically for me, for example, to recommend from a science basis that everybody should wear the mask, it's hard to say that would have a true or significant impact in addition to the other measures that have been taken. Having said that, you may see a recommendation come out today or tomorrow that says everyone should do it, and if that's the recommendation, then I think there should be some measures to also enable people to do that, like finding ways for them to get masks, etc.
Okay, thank you so much for that. Warden, I see you have a question.
Yeah, I guess it kind of comes with the mask question. It goes to gloves, and I know some of you have heard me speak of the gloves and an incident at a grocery store where someone caught their glove in the zipper while they were in the washroom and had to get help. It just, where does that mess? Yeah, they're doing more harm, I believe, by wearing gloves, and some places are making you take the gloves off before you come in and sanitize. So, is there any messaging more on gloves? I think the masks, like you said, there's a possibility it is helping, but I think the gloves are doing a negative thing when they're not used properly. Any comments on that?
Yeah, I would agree with you. I think that we can, we can go back and review some of the messages on our website and see what we're saying about gloves and make sure it's consistent with what we know. But certainly, I would agree with you. Gloves are only as good as the way in which they're used, and most people use them as if they're a substitute for hands. And if you do that, they're actually worse because you can't wash your gloves, but you can wash your hands. So washing your hands is really the key message.
Thank you. I see no further question. Councillor Ferguson, was that a question? No? All right. All right, just hiding in the bushes, I see. Thank you, Dr. Ronaday, for that rundown. We really appreciate your update. And as always, we appreciate the effort of yourself and your team in keeping us all safe and well informed. So very much appreciated, and we look forward to the next update.
Of course. Thank you.
Okay, we'll move on to item number 4 on our agenda, Infrastructure and Development Services. Under A, we have correspondence from member municipalities, items A through C. I'll look for a motion to receive and file these collectively. Councillor Ferguson. Councillor Bean seconds. Thank you. All in favor? That is carried. Are there any items out of that anyone would like to push forward any action? Warden Weaver?
The first correspondence from St. Clair Township, there's 3 requests for road work or lighting intersections and that. I'm wondering if we should, I think we should probably get a report on those requests for going forward.
Okay. And
Letters with specific requests.
Right, okay. And I may have just misread that. So that is A, B, and C were all part of the one report. Okay.
Yes. And there's 3 letters in there.
Okay, so in that you would like a report back on all 3 of those? Is that?
Yes, I believe they need to be addressed.
Okay, so I'll as a motion for a report on those 3 items within item A, the first and only item in member correspondence. Do I have a seconder for that report? Councillor Miller, any discussion? All in favor? That is carried. And on to item B, correspondence to receive and file. We have 1, 2, 3, 4, 5, 6, 7 items, A through G. I'll look for a motion to receive and file these items as one collective, and then I'll look for any action on those. Deputy Warden Marriott and Councillor Bird seconds. Any discussion? All in favor? That is carried. Now look for any items that anyone would like to pull out of that for any action. Councillor Bird.
Yes, thank you. Through the chair, I just have a question on items C and D. Have any investigations or reports been sort of brought up yet on those 2 items by staff?
Okay, so that's in regards to
the Petrolia line and Kimball Road, and the other one was Kimball Road between Petrolia line and Rokeby line. So one had suggested a roundabout, and different things had been suggested. So I didn't know if there'd actually been any investigation yet carried out by staff, or if they have any report what would work in those areas.
Okay, looks like Mr. Cole is prepared to respond.
Sure. Through you, Mr. Chair. Yeah, we are working on collecting the data and putting together some information regarding those concerns. I believe that at the last council meeting, Councillor Arnold indicated that he was bringing a motion forward on
June the 3rd, yeah.
the roundabout option there. So, I mean, ideally, we would like to bring back a full report and recommendations on these items and the options at that intersection.
Okay, thank you.
Thank you. Anything else? Okay, moving on to information reports. We have a provincial policy statement 2020 report. A motion to just double check. There's no recommendation specifically in that, so looking for a motion to receive that. Warden Weaver, Councillor Bean seconds. Any discussion? All in favor? That is carried. Is there any other business for Infrastructure and Development Services? Seeing none, we will move.
I had one if I could.
Yes, sorry, Lonnie, I can't see you there. Councillor Napper.
Yeah, I'd just like to pass on to Jason. I guess this is where we do that. For following up along with our staff on the cleanup of the off ramps and stuff. I see they're out there doing it, so just like to thank you for your involvement in that. Maybe we should send a letter thanking them for their vast efforts.
I did, if I may, I did notice they were out this morning when I came across the overpass on the sides of the roads. They're cleaning up things as well.
I think our staff got an email back from London saying that within the next few days it'd be all looked after. So that was excellent.
Great. Thumbs up from Jason Cole. That's good. Okay, thank you. We will move on. Thank you, Jason. And on to public health. Under items of correspondence to receive and file, we have 3 different items. I'll look for a letter to receive and file those, and then if we have any action to take out of that, I will ask for it at that time. So may I have a motion to receive and file items A to C. Deputy Warden Marriott and Councillor Ferguson seconds. Any discussion? All in favor? Received those. Is there anything from that list that anyone would like to take action on? We'll move on to information reports. We have 3 items under there. Reallocation of student nutrition program, a COVID-19 pandemic update report, and community paramedicine funding update. I'll look for a motion to receive those 3 reports, please. Councillor Bean and Councillor Miller seconds. Any discussion on any of those 3 items? All in favor to receive those reports? That is carried. And is there anything out of those reports that anyone would like to move forward? Yes, Warden Weaver.
I would move the recommendation. I think we're, if I'm not in the right, yeah. Item C, regarding the community paramedicine funding.
Yes, Warden, let me clarify that last motion would have been for those 2 items under B. Excuse me for that.
The first 2, yeah, okay. So I would move the recommendation in item C.
Yes, sir. And do I have a seconder for that? Councillor Ferguson? Okay. Now we will open that up for discussion if there is any. No, I have one question out of that, if I may. On page 2 of the report, there is a line that says, to date, the COVID response team has successfully completed 100% of testing for long-term care residents and staff and are scheduled to complete other prioritized congregate settings, i.e. homeless shelters, group homes, etc., as required. My only question really is what does as required? Is that upon seeing any symptoms, or is that should this team be needed to complete that work?
That's a good question. So through Mr. Chair, I'll just tell you that the as required kind of piggybacks on the testing that Dr. Ronaday described in his earlier presentation. So basically, the first requirement was to complete the long-term care and retirement homes. Now we're moving to other congregate settings. So that has started with essential child care services, and then behind that, staff have shelters prioritized as well. And Obviously, the team has to be ready to pivot and move. So should a congregate setting, i.e. a homeless shelter, have a positive case, we would head there to do service.
Okay. Thank you for that information.
Just one other thing I need to make clear. We do need an amendment with respect to the motion. It was pointed out to me that there was an error in that motion. So I would ask that Council just consider the amendment of that the base funding be received from the Hotel du Grace Hospital. The correspondence should have indicated that, and my report should have indicated that that funding is actually being directed newly now from Hotel du Grace Hospital. So Chatham Kent is putting their interests to the hospital, and then the monies will flow from the hospital to the county. So we just needed an amendment to that second last line to read the Hotel du Grace Hospital.
Okay, and I assume that's okay with the mover and seconder. It is. Okay, thank you for that, sir. Any other questions regarding community paramedicine recommendation? I see none. All in favor? Recommendation, and that is carried. Thank you, sir. Is there any other business, either from members of this committee or from public health staff? I see nothing. That's great. Thank you, Mr. Taylor, and we will move on to cultural services. Under A, information reports, we have two sets of reports here to receive. I will look for a motion to receive that. Councillor Napper, Councillor Miller seconds that. Any discussion? All in favor? That is carried. Anything from, is there anything from those two sets of reports that anyone would like to take action? That's okay. And we have one report requiring a motion. That is a set of policies. Look for a mover for that recommendation. Deputy Warden Marriott seconds. And that is a recommendation to approve those policies as listed. Is there any discussion or are there any questions? I see none. All in favor? And that is carried. Is there any other business for Cultural Services Division, either from committee members or staff? I see Warden Weaver with his hand up. Warden Weaver?
Just a question for Mr. Meyer. Don't want to let him off too easy here, but I know there's been some discussion of a plan to reopen libraries as we can with curbside pickup and that. Is there any updates on that? Just where we're going and who's first and who's on second?
Thank you, Warden Weaver. Through you, Chair White, I'd be happy to provide an update. So as this group is aware, on Thursday, the province did announce stage one of its reopening plan, which included lifting of restrictions to allow for curbside pickup and delivery service, as you mentioned. The cultural services facilities do remain closed to the public under provincial order, but this does allow us to activate the curbside pickup service. So we've been planning for several weeks in anticipation of this announcement. We had meetings with our union groups yesterday to talk about our plan and review the plan to gradually recall select staff just to support this curbside pickup service at select locations. And we'll be putting out more information later today, hopefully, on the locations and our anticipated plans to do so in a safe manner. We're currently looking at 13 locations across the county that could provide that curbside pickup service. And as I mentioned, we'll provide more details this week.
Okay. Thank you. Are there any other questions for Mr. Meyer? Or anything further from you, sir? Yes, Warden Weaver.
Not really a question, just a comment. It'll be nice to get those people back to work, get the money going in the economy again, and if we can have some people back instead of layoffs, it's always great. Thanks.
Yeah, thank you for that. And I guess I do have a question. Do we still have cultural services staff working with public health?
Rex, through you, Chair, we do still have staff redeployed to support public health with communications, as well as to EMS for inventory control of PPE, and to long-term care homes for the support with screening efforts.
Great. Well, again, I'd like to thank them as well for that that service. Certainly goes above and beyond what would be expected of them. So it's very much appreciated. Councillor Napper, I see your hand up.
Yeah, I just brought up a question there. What percentage of those people that were laid off are taking advantage of this moving around like that?
Through you, Chair White, with respect to the redeployment to support other divisions, I couldn't give you a percentage offhand, Councillor Napper, but I could say that we have, I'd say, about 15 staff that have been redeployed to support other divisions, 15 to 20 in that range.
Thank you.
Okay, thank you, sir. Is there any other new business?
Yes, Mr. Chair. It's just, if I could, on a more of a personal level, talk very briefly about the Youth Film Festival piece. There was a presentation to council last year talking about the program that was funded through Creative Counties and the success the program had to date. I think it started off getting 8 films 5 years ago, and last year they had 23 films. The films closed last night for this year, and this year we have roughly 40 films submitted. So there's been tremendous growth, and it's great support from the teachers and from the kids in the community. So I wanted to pass that on. That was a good news story, I thought, in this world of COVID-19. I also had talked to you, Mr. Chair, in your personal capacity, whether you would be interested or able to help us on the judging piece. And I can give you a call after the meeting today and see if you're available to help. So.
Absolutely. Well, shorter answer is yes. So we can certainly work out those details. I would have been offended if you didn't ask. So thank you for that. And that's exciting news. Congratulations. That's a fantastic uptake. So that's wonderful to hear. Very much appreciated.
There's supposed to be some wonderful films on Donald Trump, as well as COVID-19 and other topical issues. So we look forward to watching them.
It'll certainly be exciting and good to know what's in the minds of students and that people are paying attention. So that's actually really good. That makes me happy. Any other new business, Lonnie?
I just like to throw in a little humor here. That'd be The Nightmare on Elm Street. Is that film?
Well, no spoilers, Mr. Van. But Councillor Napper, I'll let you know. I'll give you a heads up. You can plan ahead in case you need a few hours to adjust after watching. Seeing no further new business, that looks to bring us to the end of our agenda. So this is the exciting one. I'll look for a motion to adjourn, please. Councillor Beam, Councillor Ferguson seconds that. Any debate on adjournment? Seeing none. All in favor? Thank you, everybody. Thank you to the staff for the reports today, and everybody stay safe, and we'll see you at the next one.
Yeah.
Bye all.
Take care. Take care, everybody.
Bye.
All right.